Good day, Lasallians. Today we will be presenting to you our paper entitled Alternative Learning System in Time of COVID-19 Pandemic, the Philippine Context. Together with me are my colleagues from the Center for Social Concern and Action of Dlsu University, namely Mr. Mark Benedick Chavez, Ms. Annadel Sapugay, Mr. Nico Vicente, and yours truly, TadenaTadena. The paper will be with an introduction, followed by methodology, scope and limitations, results and discussion, detailing Als at a glance, Als in time of COVID-19 pandemic, Als Learners Perspective, and of course, ending with conclusions and recommendations. The research aims to document the national and DLSU ALS experiences and practices from the perspective of implementers, learners, and facilitators to be able to learn from the challenges and interventions of implementing ALS during pandemic. As we all know, education is a key factor and catalyst for the development of any individual, family, and of course, on a larger scale, our country. It also nurtures peace, democracy, and economic growth, and further uh, develops our health and reduces poverty. In a nutshell, sustains our development. According to the United Nations Sustainable Development Goals by Kyopi and Volvolis, quality education is a recognized important tool in achieving the 17 SDGs, which is basically SDG 4, quality education, ensuring inclusive and equitable quality education, and promoting lifelong learning opportunities for all. In the Philippines, our DepEd or Department of Education focuses on the achievement of SDG 4 targets, which is and one of which is basically the implementation of the alternative learning system in the country. ALS is an intervention to provide all Filipinos free basic education regardless of the circumstances that can limit them from finishing formal basic education. And when we say circumstances, we refer to school dropouts or school leavers, those with financial concerns, and those who say they lack access to school facilities.
Okay, thank you, Sir Leo. Now let's go to the methodology. The methodologies used for the purpose of this study are the narrative model and the focus group discussion. Due to limited resources and quarantine measures in places during the conduct of the study, the scope is only limited on the information from the ALS national level and the LSU. However, it is enhanced observing the methodological triangulation. Triangulation as a methodological research technique is supposed to support both the validation and competences of research findings. Methodological triangulation is the use of more than one method to investigate a phenomenon. Initially, the researchers who use two or more data resources will achieve more rational outcomes than those who use single source. This is the basic notion of triangulation. In this study, the researchers use first a narrative model. Narrative research is just the study of how human beings experience the world. The narrative researchers collect the stories and write narrative of the experiences. Data can be in the form of field notes, journal records, interview transcripts, one's own and other observations, storytelling, letter writing, autobiographical writing, documents such as school and class plans, newsletter, and other texts, such as rules and principles, and even pictures. In this paper, the researchers from a narrative form the data gathered about the alternative learning system from the Department of Education and the Salle University, Manila, ALS. The raw material for the narrative comes from the intermental life experiences and intramental images that are not accessible to direct observations. The individual stories that emerge in text in the creation of narratives are, however, available for direct observation and interpretation. From all the data gathered, this paper explicates the effects of COVID-19 in the whole ALS program at the national and university level. Moreover, to validate and the interpretation from the data, the researchers also make use of focus group discussions with the ALS learners of Dlsu as responders. Focus groups are a common qualitative data collection method and are considered an important qualitative health research technique. The researchers particularly asked questions on the effects of the COVID-19 pandemic to the ALS learners. The group discussion also clarifies the effects of the Department of Education program and the DLSU program for the learners. A number of technologies offer proven examples of data collection methods that are cost-effective, efficient, and employ modern technology. And in this focus group discussion, the researchers use the Zoom app. This also enables the researchers to also record effectively the responses. Now let's go to the scope and limitations. The scope is only limited on the information from the ALS national level and the DLSU. Other local event implementation of ALS was not explored in this study. Thank you very much.
Let us now proceed to the results and discussion. Let's focus on ALS at a glance. The implementation of alternative education system started since 1984 through DepEd's Bureau of Non-Formal Education that was renamed to Bureau of Alternative Learning Systems or BALS in 2004. According to UNESCO, International Center for Technical and Vocational Education and Training 2011, a second chance education gives learning opportunities to individuals who were not able to finish or attend school or have not completed school for several reasons. Also, second chance education is referred to as bridging programs or reintegration programs. ALS is one of the key features of educational reform in the Philippines and is explicitly stated in Republic Act 9155 or the Governance of Basic Education Act of 2001. It puts emphasis on the right of all Filipino citizens to quality basic education, which also includes ALS for out-of-school youth and adult learners from Republic of the Philippines Official Gazette 2004. Individuals who wish to enroll in the ALS program of DepEd must have a minimum age of 11 years old for elementary level and of 15 years old for secondary level according to Benya's 2015. BALS currently operates in two forms, the non-formal and informal education as seen on Figure 1 named ALS Program Structure. Now, ALS Basic Education Curriculum focuses on six learning strands, namely communication skills, scientific and critical thinking skills, mathematical and problem-solving skills, life and career skills, understanding the self and society, and digital citizenship. On this slide, you can observe Table 1 that shows ALS trend of enrollment from year 2016 to 2020. The ALS enrollment trend for years 2016 to 2020 reflected in Table 1 shows progression through the years. It was only halted in 2020 given the circumstances caused by the COVID-19 pandemic. DLSU, through its vision mission, empowers the Center for Social Concern and Action or COSCA to lead its social development agenda through a rationalization and operationalization of a community engagement framework anchored on the Lasallian Guiding Principles, LGP, the Lasallian Reflection Framework, LRF, and the Social Engagement Framework, or SE Framework. This mandate leads to the formation of the Lasallian Sustainable Development Program, or LSDP. This then gave birth to Lasallian Accessible, Relevant, and Alternative Learning, or LARAL. It implements a full learning year of DepEd ALS A&E program of junior high school level since 2011. Let us now proceed to the characteristics of Dlsu Als. It is open for all OSYs and adults mainly from COSCA's partner barangays in Liverisa and in District 5 of Manila City. The topmost factors influencing enrollment to Dlsu Als are challenges related to finances, academics, and family. The average number of enrollees in Dlsu Als per year is 50. The program has produced 126 graduates throughout its implementation. Despite the high number of enrollees, there is still a percentage of learners who have committed issues that resulted in a low program complete rate. Technically, the passer rate is directly related to the number of learners who completed the program. Let us now proceed to Table 2, primary concerns raised by parents in relation to distance learning. The way people see education and learning in the Philippines changes this year, 2020. Some people say that there should be an academic fees, and some say the opposite. With that, different institutions and DepEd went into a lot of brainstorming to have a learning continuity plan. There were a lot of changes and transitions, and one of these is the shift from face-to-face instructions to full online or blended learning sessions to comply with the health protocols being implemented by the COVID-19 Interagency Task Force, or IATF, and to cope with the impacts of the pandemic. With the current shift to distance learning or online learning, issues and challenges were raised by the parents in the Department of Education Enrollment Survey. Topmost concerns are unstable mobile and internet connection, lack of available gadget and equipment suitable for distance learning, and insufficient load or data allowance as seen on Table 2 from Department of Education 2020 as cited in Mateo 2020. For education at national level, it was observed that one of the main challenges was the interrupted and poor internet connections for the online classes, according to Hernando Malipot 2020, Adonis 2020. Also, it was observed that DepEd still has limited movements and decisions on how to go about with the A&E test this year 2020. Let us now proceed to ALS in the time of COVID-19 pandemic. So, while in DLSU ALS program, four major challenges were observed. Some of the learners do not have access to stable internet connection. So based from the program survey conducted on the start of community quarantine around March 2020, more than half or 51.35% are using their mobile data to have internet access, and the rest have their own Wi-Fi at home. Next, most of the learners do not have their own devices for learning and are usually using mobile phones of other family members such as parents, siblings, or cousin. As experienced by these learners, they need to skip synchronous learning sessions since the gadget they are supposed to use was unavailable during class hours. Also, learners are having a hard time finishing their tasks or modules because they are always waiting for the availability of the gadget. The third major challenge was the change in learners' priorities. Some of them were full-time learners before, but because of the pandemic, they need to start earning money to help their family in terms of finances. Some of them became online sellers, food panda or grab food riders, and household helpers. Given the need to allocate time for their work, some learners decided to stop schooling to help their family. Fortunately, some learners were still doing their best to balance work and studies. The last major challenge that was observed was uncertainty of the school schedule of DepEd's A&E test, which all enrolled ALS learners are looking forward to. For year 2020, there is a delay on the implementation of the test due to the pandemic. Despite the delay, learners are continuously preparing for the upcoming A&E test with guidance from the IM and was also assisted by COSCA in learning through online tutorials provided by Service Learning Program. Let's now discuss resolutions and adjustment. The first resolution and adjustment was DepEd released an advisory last October 6, 2020 that there will be computerized A&E tests this year for those ALS program completers with ages 21 to 59 only in accordance with the health protocols. DepEd is trying their best to accommodate and exhaust all possible activities so that ALS learners can finish their education even with the impacts of pandemic. Next, COSCA utilized different online learning platforms to continue the education of the ALS learners. Learners and their guardians were also invited to attend tutorial sessions on how to use the said platforms. The learners were also given a chance to discuss with the ALSIM about the flexibility of class schedule. Google Classroom and Zoom applications were adopted to facilitate synchronous and asynchronous learning sessions. These platforms were chosen because of its user-friendly features. After almost 2 months of adjustments, learners were able to cope in this kind of learning modality. Next, provision of internet load to those learners who are in need was made possible by COSCA. Moreover, for those who do not have gadgets for online learning, it was observed and resolved by lending them Android tablets and iPads. So these gadgets were actually donated by different DLSU alumni groups. These interventions aim to ease the learners' concern in accomplishing academic tasks and attending synchronous learning session. The last resolution and adjustments made is to accommodate the learning needs of some learners who have other priorities than academics, such as work or family business. Learning sessions are done asynchronously. ALSIM uploads learning modules and recorded videos in Google Classroom where learners can read the module, watch the videos, and answer the assessment. Let's now proceed to ALS Learners Perspective. Evident unforgettable experience of Dlsu ALS learners during the pandemic is the challenge brought by unstable internet connection. To cite an example of ALS learners perspective, Alvin, one of the DLSU ALS learners said, nahihirapan lalo na pag walang internet connection. Now, the three top challenges encountered due to pandemic are financial concerns due to employment, internet connection and gadget problems, being away from the family. Most of the DLSU ALS learners resolve the challenges by looking for alternative means of living and by being extra cautious in managing their time for studies, work, and family. They also made sure to communicate via phone call to their family members or relatives who they have not seen since pandemic started. Moreover, the DLSU learners were also asked about their comments or suggestions on how to improve the services of ALS, especially during the pandemic. The first recommendation or comment is that they point out the importance of coordination between barangays in implementing ALS. Next, requests for relief and educational assistance during the pandemic. The third comment would be most of them are also longing for the face-to-face mode of classes. And lastly, requests for easier access to DepEd's information and announcements, especially for those with unstable internet connection. In general, DLSU ALS learners are satisfied in the ALS services they was able to get through DepEd and DLSU despite the pandemic. So to cite some, Sebastian, one of the DLSU learners said, nabigyan ng pansin ng DepEd para makapag-aral kami. Sobra-sobra ang tugon ng DLSU COSCA in terms of gadget and load assistance. According to Annabel, another ALS learner, nagpapasalamat sa DLSU kasi binigyan ng pagkakataon para makapagtapos ng pag-aaral. Nagpapasalamat din sa DepEd dahil sinuportahan ang ALS.
Thank you, Mark. To conclude, we'd like to say that quality, equitable, and accessible education should still be served to Filipino learners despite the ongoing pandemic. In implementing ALS program, it is very important to allot enough time to teach core modules. And collaboration with different groups, organization is very essential for the success of ALS and growth of the learnings. Our recommendations are the following: that we include the community in the learning process of the ALS learners. Program implementers should not be limited to enhancing learners' knowledge, but also improving other skills. Implementers should be more resourceful and critical thinkers in implementing the ALS since knowledge can now be easily accessed through the internet. For the academic institutions, inclusion of the ALS program or non-formal education in the curriculum of education related courses would be helpful, and it would be beneficial if the national government would invest in a unique learning management system to better facilitate the experience of the ALS learners. So this ends our presentation on behalf of my fellow authors. Thank you very much for listening.